So the Research Design Service is a national network of support services. London has its own Research Design Service. Our aim is to work with applicants, predominantly to the NIHR, but we do work with applicants to prepare applications to charity schemes and research council schemes. And our aim is to work with them to increase the quality of their grant applications so that they're more likely to attract funding. In London, the RDS is a successful partnership between King's College London, who lead, UCL, Queen Mary and Imperial College. And we've effectively divided London into 4 patches. So researchers who are south of the river come to the King's College London Coordinating Centre, those in the east end to Queen Mary, those in the west to Imperial, and those in the north central region to UCL. At each of those centres we have teams of advisors with a wide range of methodological expertise and experience of preparing grant applications. So teams typically comprise statisticians, a health economist, those with expertise in qualitative and social science research methods, and all-important patient and public involvement expertise. Primarily, our support is for research design and research methods. We provide this support to all free of charge, so the Department of Health very kindly pay for a 5-year contract for RDS to provide this support. Although we provide much more than just research design. We help you identify the most suitable source of funding. We realise it's a bit of a minefield out there, so we can help you navigate that and prepare the most suitable applications. We always review team composition. We identify any gaps, and we can help you identify suitable collaborators. We've heard a lot about patient and public involvement this afternoon. We emphasise its importance and the need to actually incorporate patient and public involvement at the early stages of study design. We always review the presented evidence and the rationale, and we help you present the best case you can and help present a good rationale for benefits to the NHS and to patients. We do help applicants who have failed to attract funding, so we can help them interpret the feedback they get from panels and help with resubmissions. And we also signpost researchers to other sources of advice, whether that be to clinical trials units or other parts of the NIHR network. Who can we help? Well, this is very broad. We can help people with various ranges of experience and at various different stages of research. We can help those with very little experience or have just an idea for research and want to develop that up further. We help people with personal awards, so those who are going to look for fellowship applications. And we can help those with much more experience or those who are targeting a resubmission. So all levels and at all stages. Access to the service is primarily online. We have a website, and on that website is a simple online support request form which collects some basic demographics and gives you the ability to attach a draft of your application which we can then review and give feedback. Working with the RDS is an iterative process. You can submit initial drafts for comment, and we can work with you and your team, give you feedback, and round it goes again. We also are developing quite a wide range of online resources, so it's worth visiting the website. The website address is at the bottom of this slide to see what information you can find there. In terms of outreach, we hold regular drop-in sessions across London. We appreciate that some people may not want to write something before they discuss an idea, so these are very good fora for people who have embryonic ideas and just want to talk through that idea before putting pen to paper. We have events and clinics that are aligned with NIHR funding calls, and we have events like today which are specifically targeting particular funding streams. We're very happy to support local R&D events at trusts, or to come out to individual research groups or clinical interest groups to promote the support of the RDS. We predominantly deliver the service in 3 stages. The first is this initial review and feedback by an experienced member of the RDS team. And this review focuses on the bigger questions. Is it an important question? Are you targeting the right funding stream? Have you thought about PPI? Is the team correct? And they use their experience of research to also provide an important triage step. So they then facilitate the support of the methodologists within the RDS. So this is very much RDS acting as primary care. You'd then receive specialist input as required. So this might be input from a statistician on sample size, from a health economist on economic evaluation, or from qualitative researchers or social scientists, maybe on mixed method approaches. So this is RDS very much providing secondary care. We then can facilitate additional support too. So we have very good links with the R&D offices, with clinical trials unit, so we can streamline your access to those additional sources of support and provide tertiary care. As mentioned earlier, to improve our efficiency, we're continually improving our online resources, and we're working up many of the issues that we see at first contact with researchers, and we write these up into online guidance for everyone to use. All applicants to the NIHR who complete the standard application form are encouraged to give feedback on the support they got from the Research Design Service, and hopefully these figures speak for themselves. Practically everyone would recommend using the RDS. They say it improves the quality of applications, and they're satisfied with the level of service that they receive. To give you an idea of the number of studies that have been funded through RDS London support, between the summer of 2009 and October 15, there were 387 successfully funded studies with RDS support, with an award value of nearly £170 million, and 68 of those were RfPB awards. So a significant amount of the work we do is working with applicants to RfPB. When should you contact RDS? Well, I think the key message is as early as possible. Ideally, we'd like to see you at a very early stage, 4 to 6 months ahead of a submission deadline, but it's that 2 to 3 months that you really need to give us to be able to work with you to a good level. So we can iterate, we can see several drafts of the application. So just a brief summary, we can provide support throughout the grant phase. We focus predominantly on NIHR grant applications, but if that's not appropriate, we can work with you to target another suitable source of funding. We have a varied range of expertise. We can cover most research designs and methods, and we have key support for patient and public involvement. So please do contact us as early as possible. So that's a brief summary of the support that the RDS can provide. Just now go back to the